Are you ready, Riley?
Yes. Can everyone see this?
Yes, we can. Yeah.
Okay, awesome. This is my article presentation. It is on the efficacy of virtual reality interventions compared with conventional physical therapy and improving upper limb motor function in kids with CP. Um, So to start, just some quick facts to get us oriented with why they conducted this study. So globally, the estimated prevalence of CP is about 2.1 per thousand live births, which I did not know. And then impairments in the upper limb, shoulder girdle, elbow, and hand joints are a very common consequence of cerebral palsy. And this can lead to muscle tightness, weakness, uncontrolled and limited movement, and just impact their daily functionality. So, where virtual reality comes in is it can help enhance their brain plasticity and organization and help them practice I think that's supposed to be repetition of tasks to increase their motor skills, and then they can use their upper extremity more functionally and improve their independence. So this study actually looked at a bunch of other studies to try and evaluate and consolidate this existing literature to see how effective VR training it is in upper limb motor function and improving upper limb motor function. So the review sought to answer the question, can VR really improve upper extremity motor function in kids with CP compared to a conventional physical therapy program? So, past research, what has been found, this article discusses three specific systematic reviews that have been conducted, and all of them had limitations. And the article goes through and kind of points out each of them. And a quote from the article said each review had limitations, and the clinical interpretation of the findings is questionable. And there were conflicting results that, quote, indicated the need for a new review to give greater transparency on the effect of VR games on upper extremity movement, hence why this study is happening. So, methodology. So, searches for data was done on various databases. Some of them are listed here. And overall, the results from 7 different studies were used. So, 7 studies that all used VR and measured upper extremity motion. The inclusion criteria is kids with CP between the ages of 4 and 17. They had to be English randomized controlled trials that compared VR games to conventional therapy and focused on upper limb function as the primary function. And then the studies had to be conducted in a clinical setting. So home settings like what we're doing weren't included in this study. Exclusion criteria is other study designs like case reports and case series. Again, studies conducted in home settings, and then studies comparing VR to a placebo or other intervention like manual therapy or hydrotherapy. So, assessment and results. There were 2 outcome measures used to get to the results. So, 4 trials used quality of upper extremity skills test, aka QUEST, as an outcome measure. And then 3 trials used grip strength. For the quality of upper extremity skills test, um, the there was only 1 study that showed a highly significant improvement with VR with Quest, and then for grip strength, the trials did not find a difference between the intervention and control groups after the intervention. So, to demonstrate our results, they made 2 albatross plots that they made 2 albatross plots to synthesize the 2 outcome measures, and the certainty of the evidence was evaluated with the grade assessment as well. So I have the albatross plots here. This is the plot for the quest outcome, and then this is the plot for the grip strength outcome measure. And then here we have our graded assessment that kind of summarizes everything. So I boxed like the overall score, which says it was very low. But if you look before that, it kind of goes through the risk of bias for all these different sections. And a lot of them say that the risk of bias is very serious, which is what leads us to get that very low certainty score at the end. And just some of the comments, it just says the evidence is just really uncertain and they're not sure yet. So, conclusion, based on this study analyzing all this past data, the effect of VR in the upper limb rehabilitation of children with CP remains unclear. Current evidence supporting this is weak, but there's also a lack of high quality research with large sample sizes about it. And the 7 studies that were used just all really had conflicting results and high risk of bias, so they didn't feel confident saying that they were sure that VR helped the upper limb rehab in kids with CP. Some potential limitations could be seen in excluding non-randomized controlled trials, and they also didn't examine the safety of using VR with kids. Um, and only using 2 outcome measures, maybe they need to add more to kind of examine more outlets of the VR system. And there were some questions on if grip strength was even comprehensive enough to be an outcome measure, because that can just be kind of ambiguous. And like, how are you measuring that? Was there consistency between each like person conducting the research? So not sure if that's super valid. And then they also only use non-immersive VR games in these studies. And there was a paragraph in the article that talked about the impact of immersive VR. And again, there's just a lack of data about it. But I know, like, in our class, we've discussed both immersive and non-immersive. So they were like, maybe that would be better for kids if we introduced that as another factor. But we don't really know, so more research needs to be done. But that's pretty much all that I gathered from this article. So I hope, thanks for listening.
Great, great. Okay, guys, do you have some questions?